back, people. We had talked about what's been going on in baby Sammy's life from when she was born to eventually. Now she's at age 12, and she starts to see some changes in her body. And her mom is really worried that she won't know what's going on. So her mom has to sit her down and explain to her that these changes, breast development, pubic hair, are due to hormonal changes. These hormonal changes basically because the gonads are developing. Now we have the two hormones responsible for
We're all set. Let's go.
the two basic hormones responsible for gonad development. I'll clean this up. Are follicle stimulating hormone and luteinizing hormone. I'll briefly talk about what they do, but once again, it's really important to read the textbook for details. So, FSH stands for follicle stimulating hormone. Once again, most of the hormones, their names gives a clue to what they do. Follicle stimulating hormone, in the case of Sammy, who is a girl, will go to the ovaries to facilitate the further development of the eggs. Now, the ovary is a very interesting structure in that it has little pockets within it that develop. Now, these pockets, inside of them is where you have the eggs. When the egg is released, different components of these pockets produce hormones. So you have estrogen will start to be released from the follicle, courtesy of follicle stimulating hormone. Estrogen's effect facilitates breast development, pubic hairs in ladies, whereas in men is testosterone, which we'll talk about later. Now, as she is about to ovulate, estrogen levels are increasing in the bloodstream. These estrogen levels will go back to the brain and say, hey, we've reached a particular amount in the bloodstream. And let's say that level is 10. When estrogen reaches the level of 10 in the bloodstream, it will cause the hypothalamus to cause the release of an inhibitory hormone that will shut down FSH, but will cause stimulation of luteinizing hormone. So LH will be released from the anterior pituitary. LH gets to the ovary. It will inadvertently cause the release of the egg. Now you have this empty sac in the ovary, which is called the corpus luteum. The corpus luteum produces progesterone. Progesterone, its job is to literally keep the uterus quiet in anticipation of getting pregnant. Now, if the person does not get pregnant, something interesting happens.